Hello and welcome to Medicalholic. In the first episode of our Meducation series we will talk about the science of medicine. What is it and why is it so important for us? What are its branches? And, of course, how did it evolve to the extent we know today? First of all, medicine is the science and practice of caring for a patient, managing the diagnosis, prognosis, prevention, treatment, relief of their injury or disease, and promoting their health. Medicine encompasses a variety of healthcare practices evolved to maintain and restore health by the prevention and treatment of illness. Medicine has been practiced since prehistoric times, frequently having connections to the religious and philosophical beliefs of local culture. Prehistoric medicine incorporated plants, known as herbalism, animal parts, and minerals. In many cases these materials were used ritually as magical substances by priests, shamans, or medicine men. Well-known spiritual systems include animism, which is the notion of inanimate objects having spirits, spiritualism, an appeal to gods or communion with ancestor spirits, shamanism, the vesting of an individual with mystic powers, and divination, the practice of seeking knowledge of the future or the unknown by supernatural means. In Egypt, Imhotep is the first physician in history known by name. The oldest Egyptian medical text is the Kahun Gynecological Papyrus, which describes gynecological diseases. The Edwin Smith Papyrus dating back to 1600 BCE is an early work on surgery, while the Ebers Papyrus dating back to 1500 BCE is akin to a textbook on medicine. In China, archaeological evidence of medicine in Chinese dates back to the Bronze Age Shang dynasty, whose name came from bronze, as it was an important material culture of the time. The evidence was based on seeds for herbalism and tools presumed to have been used for surgery. Therefore, the Huangdi Jing, the progenitor of Chinese medicine, is a medical text written beginning in the 2nd century BCE. In India, the surgeon Sushruta described numerous surgical operations, including the earliest forms of plastic surgery. Earliest records of dedicated hospitals come from Mehintal and Sri Lanka, where evidence of dedicated medicinal treatment facilities for patients are found. In Greece, the Greek physician Hippocrates, the father of modern medicine, laid the foundation for a rational approach to medicine. Hippocrates introduced the Hippocratic Oath for physicians, which is still relevant and in use today, and was the first to categorize illnesses as acute, chronic, endemic and epidemic, and use terms such as exacerbation, relapse, resolution, crisis, paroxysm, peak, and convalescence. The Greek physician Galen was also one of the greatest surgeons of the ancient world and performed many audacious operations, including brain and eye surgeries. After the fall of the Western Roman Empire and the onset of the early Middle Ages, the Greek tradition of medicine went into decline in Western Europe, although it continued uninterrupted in the Eastern Roman. The concept of hospital as institution to offer medical care and possibility of a cure for the patients due to the ideals of Christian charity, rather than just merely a place to die, appeared in the Byzantine Empire during Middle Ages. Although the concept of uroscopy was known to Galen, he did not see the importance of using it to localize the disease. It was under the Byzantines with physicians such as Theophilus Protospatarius that they realized the potential in uroscopy to determine disease in a time when no microscope or stethoscope existed. That practice eventually spread to the rest of Europe. After 750 CE, the Muslim world had the works of Hippocrates, Galen and Sushruta translated into Arabic, and Islamic physicians engaged in some significant medical research. Notable Islamic medical pioneers include the Persian polymath, Avicenna, who, along with Imhotep and Hippocrates, has also been called the father of medicine. He wrote the Canon of Medicine, which became a standard medical text at many medieval European universities, considered one of the most famous books in the history of medicine. Persian physician Rhazes was one of the first to question the Greek theory of humorism, which nevertheless remained influential in both medieval Western and medieval Islamic medicine. Some volumes of Razas's work al-Mansuri, namely on surgery and a general book on therapy, became part of the medical curriculum in European universities. Additionally, he has been described as the father of pediatrics, and a pioneer of ophthalmology. For example, he was the first to recognize the reaction of the eye's pupil to light. In Europe, Charlemagne decreed that a hospital should be attached to each cathedral and monastery, and the historian Geoffrey Blainey likened the activities of the Catholic Church in healthcare during the Middle Ages to an early version of a welfare state. It supplied food to the population during famine and distributed food to the poor. The Church also established a network of cathedral schools and universities where medicine was studied. The Schola Medica Salernitana in Salerno, looking to the learning of Greek and Arab physicians, grew to be the finest medical school in medieval Europe. However, the 14th and 15th century Black Death devastated both the Middle East and Europe, and it has even been argued that Western Europe was generally more effective in recovering from the pandemic than the Middle East. The major shift in medical thinking was the gradual rejection, especially during the Black Death in the 14th and 15th centuries, of what may be called the traditional authority approach to science and medicine. This was the notion that because some prominent person in the past said something must be so, then that was the way it was, and anything one observed to the contrary was an anomaly. Physicians like Vesalius, the author of De Humani Corporis Fabrica, an important book on human anatomy, improved upon or disproved some of the theories from the past. Bacteria and microorganisms were first observed with a microscope by Antony van Leeuwenhoek in 1676, initiating the scientific field microbiology. Michael Servetus rediscovered the pulmonary circulation, but this discovery did not reach the public because it was written down for the first time in the manuscript of Paris in 1546, and later published in the theological work for which he paid with his life in 1553. Later this was described by Reinaldus Columbus and Andreas Alpino. Hermann Boerhaave is sometimes referred to as a father of physiology due to his exemplary teaching in Leiden and textbook Institutions Medicae in 1708. Pierre Fauchard has been called the father of modern dentistry. During the modern era, veterinary medicine was, for the first time, truly separated from human medicine in 1761, when the French veterinarian Claude Bernoullat founded the world's first veterinary school in Lyon, France. Before this, medical doctors treated both humans and other animals. Modern scientific biomedical research began to replace early Western traditions based on herbalism, the Greek four humors and other such pre-modern notions. However, the modern era really began with Edward Jenner's discovery of the smallpox vaccine at the end of the 18th century, inspired by the method of inoculation earlier practiced in Asia, Robert Koch's discoveries around 1880 of the transmission of disease by bacteria, and then the discovery of antibiotics around 1900. As science and technology developed, medicine became more reliant upon medications. Throughout history and in Europe right until the late 18th century, not only animal and plant products were used as medicine, but also human body parts and fluids. Pharmacology developed in part from herbalism, and some drugs are still derived from plants, like atropine and aspirin. The first antibiotic was asfenamine, salvarsan, discovered by Paul Ehrlich in 1908 after he observed that bacteria took up toxic dyes that human cells did not. The first major class of antibiotics was the sulfa drugs, derived by German chemists originally from azo dyes. Modern biotechnology allows drugs targeted towards specific physiological processes to be developed, sometimes designed for compatibility with the body to reduce side effects. Genomics and knowledge of human genetics and human evolution is having increasingly significant influence on medicine, as the causative genes of most monogenic genetic disorders have now been identified, and the development of techniques in molecular biology, evolution, and genetics are influencing medical technology, practice and decision-making. And we end up to today, where the society fights against the pandemic of COVID-19. In order to win this fight, it's required the cooperation of all the medical branches. But who exactly are they? Working together as an interdisciplinary team, many highly trained health professionals besides medical practitioners are involved in the delivery of modern health care. The scope and sciences underpinning human medicine overlap many other fields. Dentistry, while considered by some a separate discipline from medicine, is a medical field. Physicians have many specializations and subspecializations into certain branches of medicine. There are variations from country to country regarding which specialties certain subspecialties. The main branches of medicine are basic sciences of medicine, medical specialties, and interdisciplinary fields, where different medical specialties are mixed to function in certain occasions. There are plenty of basic sciences, like anatomy, biochemistry, and biomechanics. Correspondingly, there are several types of medical specialties. These include, among others, dermatology, neurology and surgery. However, in order to be able to manage all the available information safely, there is a system of moral principles that apply values and judgments to the practice of medicine, called medical ethics. As a scholarly discipline, medical ethics encompasses its practical application in clinical settings as well as work on its history, philosophy, theology, and sociology. 6 of the values that commonly apply to medical ethics discussions are: autonomy, according to which the patient has the right to refuse or choose their treatment; beneficence, in which a practitioner should act in the best interest of the patient; justice, that concerns the distribution of scarce health resources, and the decision of who gets what treatment; non-maleficence, that goes against any harmful intention; respect for persons, according to which the patient and the person treating the patient have the right to be treated with dignity; truthfulness and honesty. Values such as these do not give answers as to how to handle a particular situation, but provide a useful framework for understanding conflicts. When moral values are in conflict, the result may be an ethical dilemma or crisis. Sometimes, no good solution to a dilemma in medical ethics exists, and occasionally, the values of the medical conflict with the values of the individual patient, family, or larger non-medical community. Conflicts can also arise between healthcare providers, or among family members. And these were generally all you need to know about medicine. Don't forget to subscribe and hit the bell, so you get notified about future videos. Also, give a thumbs up, so you help Medicalholic reach more people. Comment your thoughts and questions below. Until the next time, stay safe.